Hello, everyone, and welcome to another episode of Ask the Doctor. This time, we sit down with Dr. Spencer Lee from Cherokee Lung and Sleep Specialists. Doctor, thank you for being with us. First question I have for you, what is lung cancer?
Yeah, and I'll kind of take you through it, and I do really appreciate you guys being here and getting some insight into my world a little bit. I do what they call pulmonary critical care, which is lung disease in the ICU. So in the world of lung disease, lung cancer is obviously a big proportion of that. And it is basically an abnormality or a group of cells that are abnormal within the lung that kind of slowly grow over time. And there's a lot of different varieties from that, a lot of different causes to that. But it is basically an abnormal group of cells within the lungs that traditionally would start as what we call a pulmonary nodule or a spot in the lung that would get bigger over time. So I know people are used to hearing cancer in a varying different organs, whether it be breast cancer, lung cancer, prostate cancer, but that's how traditionally a lung cancer would evolve.
What are the biggest risk factors for lung cancer?
Yeah, of course, the biggest one, and that would be worldwide, would be smoking. Probably about 80% or so of lung cancers are in people who smoke, with the remaining 20% being in non-smokers, but smoking by far is the highest risk factor.
Do genetics play a role in the risk for lung cancer?
There can be. There's people that definitely have a higher predisposition to that, or where it's carried down through genetics in their family tree. So there is a component of that as well.
How important is lung cancer screening?
Yeah, and I think that's been the biggest push in my world, probably over the past at least 10 or 15 years, is trying to catch lung cancer earlier. And that, very similar to other cancers as well, is if you can catch it earlier, there will be better treatment options and plans moving forward. So catching it early is definitely key. So definitely seeing a lung specialist or pulmonologist is what we're called, especially if you're in that higher risk category of having smoked in the past. There is a very big push for what we call lung cancer screening through CAT scans that has been out probably at least that same time period. So just getting in front of a doctor, specifically a pulmonologist even, like myself, would help guide that whole path.
What is the treatment process for lung cancer?
Yeah, I think step one is basically trying to diagnose that, and usually that's going to come from some sort of imaging, whether it's an X-ray or CAT scan, and to get a formal diagnosis behind that would take some sort of biopsy. I know we end up seeing a lot of people with these spots in the lungs or areas in the lungs that look abnormal, and unfortunately, even though the pictures are very good nowadays, they don't tell you what it is and just that it's something abnormal in the lung. So getting a real tissue biopsy is number one. And depending on the type of lung cancer, the treatment does vary quite drastically, whether it be from surgery, chemotherapy, radiation, and even the newer kind of immunotherapy. So it really just depends on what type of lung cancer it is, and then going from there.
What symptoms are associated with lung cancer?
Yeah, and I think, again, the big push for the screening is because a lot of lung cancers could be caught so early that people don't even know. We call that asymptomatic, meaning you don't have any symptoms at all, and there is something abnormal already going on in the lung. So I think if you are in that high-risk category, getting screened would definitely be number one. Now, kind of the earliest symptoms, sometimes people have a little bit of an issue with breathing, sometimes a cough, maybe a little bit more tired. As it gets more advanced, you'll see people that start to lose a little bit of weight and just feel really run down. Those would be kind of the big symptoms, but hopefully if you're in that category of being in the higher risk, getting screened would help prevent a lot of those symptoms from coming and catching something very early.
How much does age increase the risk of having lung cancer?
Definitely a lot. So we see most lung cancers, again, around the age 60, 65 would likely be the average. Obviously, the older you are, the higher risk. Again, it isn't something that's traditionally in a younger population. We do start the screening process for the recommendation being at 50 nowadays, so that age has dropped throughout the past 5 years. But we start the screening from 50 to 77, but kind of the average age would probably be right around that 65.
So what about a patient who has been screened outside of your practice?
Yeah, so this is something that, again, in our practice, we see all day, every day at Cherokee Lung and Sleep. We see a lot of people that come in and just say, here's an outside film that I got somewhere, whether it be an X-ray or CAT scan, and says, hey, someone told me I have a spot or a dot or something abnormal. So we have specific clinics that actually look at that through our lung nodule clinic, and any of our board-certified pulmonologists would be able to handle a request like that. And so first things first is basically to say, what is the risk of that abnormality being a cancer? And what to do about it. So a lot of people Probably 80% of these spots are luckily benign, and you're talking the 20 to 30% that could be problematic in regards to a lung cancer. So the vast majority can be absolutely normal from old cold, coughs, flus, just living in the world. But we definitely want to rule out cancer, especially if it has certain features to it. So we'll take a look at the images ourselves and decide whether performing a biopsy should be done. And if we're going to pursue a biopsy, it's something that either ourselves or through Northside, through our interventional radiology group, they can do a biopsy from the outside inside versus us doing it on the inside. Myself and my group do what we call bronchoscopy, and specifically the bronchoscopy with endobronchial ultrasound, which is a whole handful of things to say, but basically we can take a look on the inside of the lungs, kind of the pipes of the lungs, and try to get a diagnosis that way. And sometimes that's a safer route to go in particular patients. To look on the inside to get the biopsy, and then once they look at it through the pathology group under a microscope and tell us what it is, then you're really off and running. Then basically getting you in front of our Northside oncology team through our cancer specialists. They'll be able to tell you what type of cancer that is, all the genetics behind it, and really what the best pathway is. And a lot of lung cancers, again, with the push being to catch them early, the main reason behind that is there are surgical options for some of these cancers, and whether you can just completely remove the cancer altogether. So for very localized tumors in certain subsets, that's an option, and usually if that's an option, that's the best one, just to basically get rid of it. So there's basically options across the board, and I know a lot of people get nervous when you toss around words like chemotherapy and immunotherapy and surgery, but there's definitely options that improve survival long term, and just having that discussion kind of in a multidisciplinary approach. You know, we utilize the Northside Oncology Group and Thoracic Surgery Group and ourselves and really get together and find out the best kind of medical treatment plan and work with everyone to see what they're comfortable with and what they want to do moving forward.
How do you determine how serious a lung cancer is?
Yeah, so again, depending on the subtype of lung cancer, there is a staging system for both sides of that. People are very used to hearing like 1, 2, 3, 4, with 4 being the worst and 1 being the best. A lot of times there will be a little bit more workup in regards to getting that information after that initial biopsy. A couple of those avenues are something we call an endobronchial ultrasound, where we're able to look at those lymph nodes within the chest and actually biopsy them. The same would be true as some of the other nodules in the lung. The future in our world tends to be robotic bronchoscopy, where we're able to basically use robotic technology and advance our cameras a lot further out than we were before to get to other areas in the lung and nodules to biopsy them to basically prove or disprove anywhere else that that cancer might be. And that's really what the cancer staging is basically proving whether it's just one spot or multiple. So usually that'll take a procedure to basically identify, or at least what we call a PET scan, which is through the Northside radiology program, where you can pick up active cells throughout the whole body. It's basically a head to mid leg kind of scan just to make sure there's no other abnormalities, in hopes that you did catch something very early in a stage 1.
What is the quality of life for someone after lung cancer treatment?
Yeah, so if we tell them that they unfortunately have lung cancer, but then we do a staging and a surgery is offered, like I said, medically speaking, that's usually the best route, where potential curative options would be available in a lower stage. And we would do something we call a pulmonary function test, which is a breathing test to check on someone's lung function to make sure they could handle a lung cancer surgery. Meaning, if they remove an area of the lung, are you still going to be able to breathe and live normal life and not be on oxygen, that kind of thing? If the lung function was to a point where we thought that would affect someone, then obviously we would not recommend having surgery for that cancer. But for most people, if their lung function is fairly at a good range, it is something that in theory someone can breathe on one lung and be normal and live their normal life and not need oxygen or anything. So actually just removing an area of one lung is usually pretty well tolerated and doesn't affect your actual lung function that much. And that's why, again, going back to the symptom-based items, is that, you know, lung cancer, for someone to feel that, it actually has to get fairly big and aggressive, because again, if you just have one spot in one lung, you do have a whole nother lung that you're breathing on and feel absolutely fine. So the same would be true with surgery. We would just do this breathing test, make sure your lung function is intact, and then kind of pursue those options from there.
Well, Dr. Lee, that's all the questions we have for you. Thank you for being with us.
No, thank you guys so much for your time. We really appreciate it. And if there's any other information or anything we can do to help anyone, we're happy to do it. We do service all of Northside Cherokee and the hospital itself, and that's where we do our procedures. And we do actually have 4 outpatient clinics all the way from Ellijay, Canton, Woodstock, and down in Kennesaw. So happy to help wherever we can. Feel free to give us a call and look us up at Cherokee Lung and Sleep Specialist, and hope to see some of you guys soon.
This has been Ask the Doctor, presented by Northside Hospital, Cherokee.